Hi, it's Callum. So we're going to look in the next three videos at the three phases of the menstrual cycle. So the first one I'm going to look at is the proliferative phase. The next, we're going to look at the secretory phase, and we're going to finish with the shedding or menstrual phase. So this is the proliferative phase, which happens on approximately day 6 to 13 of the ovarian cycle. So this is a biopsy. So in contrast to the last section, which is a full section through the uterine wall, obviously you can't do that in normal practice when you're just taking a biopsy. So what we tend to get is a superficial fragment containing endometrium only, with no myometrium. Often this is actually quite a good sample with quite a lot of tissue. Generally, it doesn't. We get samples that are quite a lot smaller than this, which can add to the challenge. But this is a good amount of tissue here. So at low power, we're looking at the endometrium, and straight away I know pretty much that this is going to be proliferative endometrium because of its tissue architecture. So at low power, you look at the architecture, and high power, you look at the cytology. And at low power here, we can see, I'll maybe just zoom in a wee bit more so you can appreciate it a little bit better. But at low power here, we can see the architecture is made of these tubular round structures, these round glands. Lots of round glands. They're all pretty much the same size and shape, and they're interspersed with a quite cellular stroma. And right away, that tells me this is the proliferative phase of the endometrium, because really nothing else will have, the other phases won't have this appearance, as we'll see in a minute. But if we can go on to high power to confirm that. Let's get high power. Yep, so this is a good field. So again, round tubules, all pretty much the same size and shape, made of epithelium with tall nuclei, elongated nuclei. And quite frequently, you can see here and here and here. If you remember our earlier video, we talked about mitotic figures. This is an area where mitotic figures are very diagnostically useful. So these are all mitotic figures. I remember if that kind of fluffy, you lose the nucleus. Instead, all you see is this kind of fluffy chromatin, which tells you that these cells are dividing. So there's frequent mitotic figures both within the tubules, which are dividing, and also if we look within the stroma too. There's mitotic figures within the stroma, which is also replicating, and the cells are replicating and it's dividing too. So yeah, so that's proliferative phase endometrium. One last thing I'll finish by saying is that we always look in this circumstance at the gland to stroma ratio. So the glands, although there's lots of them, if you think about the area of and create a ratio between what is the area that's taken up by glands, the area taken up by stroma, hopefully you would agree this is under 50% gland to stroma ratio. If it's over 50%, we call this hyperplasia, endometrial hyperplasia, and that's really important. That's really the main reason usually they take biopsies of the endometrium is to look out for hyperplasia or atypical hyperplasia, and that is because hyperplasia is a precursor or risk factor to endometrial adenocarcinoma. So there's a well-described pathway that goes, normal endometrium to endometrial hyperplasia to atypical hyperplasia to endometrial carcinoma. And so we're looking for those precursors to catch those before patients have developed endometrial carcinoma. So we always look out for that. But that's not what we're looking at here. Here, this is normal proliferating phase endometrium. Okay, we'll move on now to talk about secretory phase endometrium. Okay, speak to you soon.